Hello and welcome to our first issue of the Brain Discovery series. I am your host, Ellie Menashe. The Brain Discovery series features Dr. Kester Nedd, a board-certified neurologist, neurological rehabilitation, and trauma specialist. Dr. Nedd is now also a newly published author. Congratulations.
Thank you.
His new book is titled Concussion, Traumatic Brain Injury from Head to Tail. So, Dr. Nedd, as a brain injury specialist, can you please differentiate between a concussion and a traumatic brain injury?
Yes, this is a confusing subject to many, even in our profession. A concussion we tend to think of as the less severe form of the disorder, while traumatic brain injury we think of the more severe form. The effects last much longer as compared to a concussion where it will last generally no more than 10 days, once in a while up to 30 days, and sometimes go beyond. The effects, while some persons with concussions could have severe disability, generally disability is not as severe, except in a case where you've had recurrent concussions to the head.
All right, so let's define a concussion.
A concussion occurs when there is the application of a mechanical force to the head affecting the brain. And the other components of this is that it causes a physiological disruption of the functioning of the brain. And the third component to this is when there are signs and symptoms. Signs, we tend to think of what we as the clinicians, the doctors see. Symptoms, we think of what the patient experiences.
All right, so briefly, let's go over some of the mechanical forces that could disrupt the brain.
So the mechanical forces, and I'll try not to be as technical. So for example, if you're involved in a motor vehicle accident and you're running at a high speed, impact your head during the accident against the windscreen. That's a kind of high speed, high impact injury to the head. That causes some of the most severe forms of injury, as compared to, say, if you fall, slip and fall, hit your head against the floor, that's a low speed, low impact injury. Again, the injuries are to a lesser degree. Another would be a penetrating, high speed, high impact injury, such as you would see in a bullet going through and through the head. Or a knife, which would be more of a low speed, low impact, but also could cause some significant damage. The third type of injury would be what we classify as a blast injury. We see that in military situations, like when you have an explosion from a bomb. It creates a pressure wave in the atmosphere, and that pressure wave is enough to sometimes cause injury. We see this in many of the persons coming back from military conflicts.
Right. Okay, so what about some of the physiological aspects?
So on a physiological basis, the disruption occurs when the organization of the brain is disrupted. Think of the brain as a highly organized structure with lots of nerve cells, lots of wires, so-called axons or electrical wires going through the brain with neurochemicals floating around. And all of those become disorganized. Once those systems become organized, the functions are impaired, causing the signs and symptoms.
Okay.
So the signs and symptoms that you typically see in a traumatic brain injury, well, mostly in a concussion, which would be to a lesser degree, would be a disruption literally in the body's ability to interpret what's going on in the environment, such as when you have dizziness and vertigo. And that's one of the most disabling symptoms. You also see headaches. Some of the more cognitive and neurobehavioral symptoms would be the patient describes themselves as being in a mental fog. They can't focus, can't concentrate, can't multitask, can't recall things, have word finding difficulties, coming up with names. Sleep disturbance is very common in this. In the most severe forms, you see more neurological impairment, which would be traumatic brain injury, such as a weakness, trouble with speech, and a more severe cognitive and neurobehavioral symptoms.
All right, well, thank you so much for that definition of concussion and differentiating between that and a traumatic brain injury. That is all the time we have for today. Thank you very much, everybody, and stay tuned for our next issue of the Brain Discovery series, where we will be discussing concussions as a silent epidemic. Thank you.
Thank you.